If you've been told that pelvic organ prolapse is just something you need to deal with or you need to go have a surgery, well, you're not alone. Many women are dealing with pelvic organ prolapse, but not a lot of women are talking about it. So today in this video, I'm going to guide you through pelvic organ prolapse, how you can regain control and feel empowered if you do have prolapse. My name is Dr. Dawn Andalone. I'm a pelvic floor physical therapist, and prolapse can come in all forms. There are different stages of prolapse and different types, but I don't want you to be scared about it. I would say that most women, if they think they have it, they go online, start Googling their symptoms, and they get totally freaked out. So stop doing that and go back, watch more videos on my channel about it so I can make you feel more empowered, more confident that you can get through this. Now, pelvic organ prolapse happens when there's a weakening in the area around the pelvic floor and through the ligaments that hold your pelvic organs in place. Now, you have your bladder, your uterus, and your rectum. And the vaginal wall and that supportive structure of your pelvic floor supports those pelvic organs and serves for sexual function, for bowel and bladder function, and support at the bottom part of your pelvis when you're moving around. But what happens down the road? Why does pelvic organ prolapse happen? It can happen for a variety of reasons. Sometimes after childbirth, that area has become more weakened after labor and delivery or after pregnancy. And also sometimes women are going back to activity too soon, doing a lot of heavy lifting or straining over time. If you have digestive issues or a lot of constipation and you're straining on the toilet a lot, that actually can sometimes cause prolapse. Sometimes during menopause and beyond, as the hormone levels are shifting, that also creates a weakening around the pelvic floor muscles. And therefore, if you talk to your doctor and are appropriate for hormone replacement, that too can also help the structures around your pelvic floor be able to work on more supportive and strengthening and stability there, as well as the right types of exercises. Now, pelvic organ prolapse too, sometimes with a lot of straining, a lot of coughing. I see women sometimes that have been sick for a long period of time. This especially happened after the pandemic when a lot of straining and coughing, and they already had some weakness in their pelvic floor area, and that also made their symptoms worse or created the symptoms to now call it a prolapse. Now, stage 1 through stage 4 prolapse, there are different stages. At stage 4, you can visibly see a bulge through the vaginal area or the rectal area. And therefore, a lot of times your doctor may recommend you going in right away for surgery. But if you have not tried things like pelvic floor physical therapy or being fitted for a pessary, stage 1 through stage 3, your symptoms can be very much eased with doing a more holistic approach, and surgery is not always necessary. I have actually seen women with a pretty severe prolapse, stage 4, that opted not to do surgery and had a normal life, but had to learn strategies and ways to help ease their symptoms. Now, what does pelvic organ prolapse usually feel like? It may feel like pressure or heaviness in the vaginal or rectal area. It may be uncomfortable to sit for long periods of time. It may be uncomfortable or feel more of that pressure or heaviness if you're standing for a long period of time, like you're a nurse or a teacher and have to stand all day at work, and the end of the day you're really uncomfortable. It may feel like lower back pain or sacral discomfort, or even lower abdominal pain. Those are all symptoms of prolapse that can be improved with the right strategies. Now, did you know pelvic organ prolapse actually affects 50% of the women over the age of 50? It's more common than women talk about. And if you haven't sought out help for it, just know you're not alone. because women don't talk about this, it actually is very helpful to see a pelvic floor physical therapist, because then you'll realize you are not alone, that a lot of women do go through this and also get over it in a more natural way with the right strategies. So I'm going to repeat those non-surgical solutions in a more systematic way for you. Number one is doing the proper restorative pelvic floor and core related exercises. I'm not just talking about going and doing Kegel squeezing exercises and tightening your pelvic floor. That oftentimes can make your symptoms even worse. So doing a more thorough program, we use Pilates at my studio, but Pilates-based training with someone that is a physical therapist, especially a pelvic floor physical therapist, can be very helpful to learn how to relax your pelvic floor, but also how to work on strengthening it too. Now, it's not just your pelvic floor. Your pelvic floor is just the bottom part of your core, but it's made up of your abdominals, your diaphragm, and your lower back. So those muscles in this whole area, from your lower back muscles and abdominals, and diaphragm and pelvic floor, they need to learn how to work together. Pilates-based principles can work on alignment, breathing, posture, and be helpful so you're not straining and bearing down on your pelvic floor. There are a lot of Pilates studios that teach Pilates in a more fitness realm and high intensity, and that's not what I'm talking about. I'm talking about more therapeutic type of Pilates that's going to address how to breathe properly and how to activate those muscles as you're moving the rest of your body and providing a lot of stability through there. The stronger your hip muscles are too, does affect your pelvic floor area. So your hip muscles being stronger and more supportive, you're going to put less pressure and tension on the pelvic floor area. I've seen this time and time again that a lot of the clients that we see that have prolapse, they have very little glute strength, hamstring strength, and even lower abdominal strength. So working on those areas can drastically improve someone's symptoms as well if they're doing it the correct way. Now, on this channel, you can go back to some of my other prolapse videos that'll talk you through some basic exercises to start doing, or you can look at my pelvic floor Pilates program that I'll put in the link below that also can guide you in the right direction and teach you how to actually use your pelvic floor in a safe manner through some simple Pilates-based videos and 15-minute workouts in that program. Number two, pelvic floor physical therapy. I can't say this enough, not only because I've seen it work with so many women and what I do for a living, but women have commented on the videos on my channel that have sought out pelvic floor physical therapy, saying it changed their life, and they didn't realize that there was a profession of someone that can help them. So just know your doctor may not send you directly to a pelvic floor physical therapist, but seeking out to see one on your own, and in the USA, you have direct access and can go call a pelvic floor physical therapist to be seen. Now, it may or may not be covered by your insurance, but I can honestly say that a couple visits with a pelvic floor therapist, you're going to learn way more about your body and also be guided in the right direction of what to do and what not to do for your specific goals and symptoms that you're having. Then lifestyle adjustments, learning things that are going to be part of your daily life. So whatever you do for your job or whatever you do for your hobbies or your sports, but learning how you can not just modify, but how you can make them more effective. So if you are someone that does lift weights, that you're not breath holding and bearing down, but you're actually using your exhale when you're lifting weights. If you're someone that does have digestive issues and you're straining a lot on the toilet, but learning how to actually make that better with use of a squatty potty, use of some digestive changes. Maybe you need to consult with a nutritionist, someone that is going to help you with those digestive issues so the prolapse symptoms are not affected by that. And also weight management. If you are overweight, sometimes that can make your symptoms even worse. You're putting more downward pressure on your pelvic floor and through that midsection, and therefore losing weight and learning strategies where you can actually get a jump start on your weight loss is going to help your prolapse symptoms too. And then last but not least, but getting fitted for a pessary. A pessary is a device that can be able to be inserted through the vaginal area and therefore can create a lot of extra support so you don't have as much of that pressure, heaviness, and symptoms down the road if you want to be more active. I have found the combination of seeing a doctor and possibly getting on some hormones, doing the right types of Pilates-based exercise, and then using a pessary if needed. The combination of those can be highly effective for treating a prolapse symptoms for the long term in a more holistic manner if you don't want to opt for surgery. Now, surgery can come with risks too. It's not always necessary, but I would recommend if you are going to go down that route, definitely seek the advice of at least 2 doctors, get different opinions, and therefore you can find the right fit for you. I want you to find the best holistic healing option for you. Now, if you haven't already, go back to this channel and watch other videos related to prolapse and take a look at my pelvic floor Pilates healing program. I'm going to give you the best ways and the best exercises to help ease your prolapse symptoms. Thanks so much for watching, and we'll see you again in another video.